Thank you guys for being willing to listen through lunch. I just want to introduce Ms. Easy, who I think most people know her. Maxine is one of the Transplant Coordinators who evaluates the patients from the implementation clinic along with the rest of the multidisciplinary team. So she's going to talk to us about the evaluation process for the transplant kidney transplant.
Good afternoon, all. So today the objective is, at the end of this presentation, the learner will verbalize the understanding of the kidney transplant evaluation process, focusing on the pre-transplant process and the reevaluation process. So as we can see from this slide, most of our patients are coming from the dialysis center, and that's the center of our process, which is the dialysis patient and the patients who are preemptive, who have not started dialysis as yet. Our team of transplant specialists, as you can see, includes the physicians. We have two dedicated surgeons, Dr. John and Dr. Somrani, and recently we have Dr. Brusner, who have joined our team. We have our nephrologist, Dr. Tedler, and Dr. Braw, the nurse coordinator, myself, Ms. Briggs, and Ms. Susan Green, who recently joined our team. Our financial coordinator, we have a dietitian, and we have a dedicated group of dialysis outreach coordinator, Mary. We had another person who left us, who did a really awesome job. And we also have our staff assistant. So how do we get patients into our clinic to see us? They are referred by the nephrologists, the outreach coordinators bring patients in, and some patients are referred by their primary care PCP. Others are just walking, they call, they want to know more about transplant. Our initial clinic appointments are made through our staff assistants or by the dialysis outreach coordinator. Most of the time before the patient comes to us, the dialysis units are faxing over all the information that they can about the patient. Labs, nephrology consults, social worker notes. Special note is that most patients, before they come in, we encourage them to bring a support person with them, or if they have a potential living donor. At the time when they come in, if they do bring a potential living donor, we screen them the same day, not by the recipient coordinator, but by another coordinator. If they are a potential donor, what we do that day is we do their blood type, HLA matchup. If all works out, they'll eventually do a 24-hour urine collection. And if that works out, then they go further on to do ultrasound, EKG, chest X-ray, and we then have a donor meeting and make a decision whether this is a good donor to match this recipient. So the initial clinic visit for our pre-transplant patient, they come in, vital signs are taken, then they meet individually with each member of the transplant team. And you can see this is our transplant team members from different disciplines. So the patient do see the surgeon and the nephrologist, who they do evaluate the surgical side and the medical side of the transplant evaluation. Some patients are ruled out initially based on maybe medical contraindication. Some of them may have severe heart disease. Some of them are surgical risks, cancer, obesity, etc. If a patient is deemed a medical rule out at the initial visit, we do have a meeting where the team meet and discuss the patient medical condition during conference for a final determination of how to move forward with this patient. The patient and the dialysis care team is then informed of the team decision via telephone and also mail. These are some of the things that are done during the evaluation process. Patient meets with the social worker, the financial coordinator to make sure, especially with the financial coordinator, to make sure that transplant plan does not become a burden to the patient. No out-of-pocket costs is dumped on the patient. The tissue typing lab team work tirelessly, and these are some of the things they do. There are more technical stuff that they do that I don't understand, and I can't impart it to you, and you wouldn't understand if I go through that. Part of our job as the transplant coordinator is a lot of education, patient and family education. Sometimes we do a PowerPoint presentation, and when you do become a pro, you can speak without that. Our patients do need a lot of education. I've had patients walk into the clinic to say, I am here for a kidney today, which then you have to re-educate them that this is not how the process goes. You don't come to an evaluation and get a kidney right away. We do a lot of consenting with the patient. We arrange a series of testing for them. This is after they have seen the nephrologist, the surgeon, the social worker, and they've gotten the green light to go ahead to work them up for listing on the kidney transplant list. Dr. Tedler covered some of this, where these are some of the testing that we send them for: chest X-ray, age-appropriate testing such as mammogram for women over 40, pap smear for most women over the age of 21, colonoscopy over the age of 50. It may go lower if the patient has any risk factor for colon cancer. Even though we're doing some of these testings, some of our insurance carriers do require more extensive testing that we as a transplant team don't require them to do. One of our big insurers, HIP, they want additional testing. Some patients come to us, and even though we're doing all of these testing, some of them requires additional consultation, such as sending them to the GI doctor. Maybe they come with hepatitis C, maybe they come with HIV. It doesn't rule them out right away, but they still do need that consultation to give us the green light to go ahead to say they're okay for a transplant. Some of them may require psychiatric consultation individually. Some patient may have bipolar, schizophrenia, and other varying mental health problem that her social worker have picked up on and decide that they need clearance. After we've seen most patients in the clinic, this is our workflow I'm trying to go through as simply as possible. After we've seen patients in the clinic, we do have what is called a selection committee meeting where the team meets and we review everything about the patient, their clinical information, diagnostic testing, HLA, etc., their insurance. And then the team do make a decision about whether or not this patient is ready for listing or to be put on the transplant list. After a patient has been put on the transplant list, we have what is called an annual reevaluation. They're seen annually to assess continued candidacy for kidney transplant. And it's the same process all over. They come to the clinic, they're triaged. Did I just finish this? They come to their triage, and the process starts all over again, which is they have to do annual cardiac evaluation, other necessary testing that they need to remain on the kidney transplant list. Thank you.
I have a question.
Okay.
Donors want to give a kidney to a type 2 diabetic. Does the donor have a glucose tolerance, or do we wait A1C?
We
The donor is giving a kidney to a diabetic. Does the
Yes, they do. We do the A1C and we do the glucose tolerance, and especially if they have a family history. Yes. Was I quick?
Oh, no, it's okay. Oh, I guess I
All
did
right.
that.
There.
Good job.